what comes to mind when you think of a fungal infection? Probably athlete's foot or infected toenails. Gross, right? Well, these are relatively not too concerning and are limited to high school gyms. But what if I told you there's a fungus that turns people into zombies and creates an apocalyptic world? If this sounds familiar, I'm referencing the popular game and show The Last of Us. While The Last of Us may be a work of fiction, there is a real-life disease that exists today, and it's called valley fever, or coccidioidomycosis. But what's so important about valley fever that I've dedicated my entire TED Talk and PhD research to this disease? In these next few minutes, I hope to raise awareness about valley fever and how you can do your part in improving diagnoses. The valley fever fungus grows in the soil similar to mold on a piece of bread. And during rainy and very wet seasons, like the ones we've had a few months ago, the fungus continues to grow and spread. But during dry seasons, in the summer, the soil will dry out and break into tiny pieces, releasing spores that can be swept into the air. This can be caused by construction, digging activities, wildfires, or even earthquakes. Anybody can become infected just by breathing in these spores. Those of us may not even know we've been infected. In fact, 60% of people don't even have symptoms, and the other 40% have symptoms ranging from mild to severe, but we still don't know who may get what symptoms on what spectrum. The fungus can spread beyond the lungs into the brain and even the skin, causing a rash, and even your bones and joints. Typical symptoms include fever, cough, chest pain, night sweats, headaches, shortness of breath, and even a rash. Many of us may not know we've been infected, and even this disease primarily significantly affects those of us of African American and Filipino descent at a significantly higher rate. And it's often misdiagnosed for things like COVID, pneumonia, or even the common cold or flu. I'd like to share a story about Greg. Greg is a 40-year-old male who came from the Midwest, recently took a job near a construction site. After a few weeks of work, he started to not feel like his usual self and started to feel fatigued and had this unusual cough that he just couldn't get rid of. And so his wife, Mary, urges him to go to the doctor. He gets checked out, and after a few weeks, he's diagnosed with pneumonia, prescribed antibiotics that just aren't helping his case. Symptoms progress. After a few months, he starts to have confusion and headaches and neck pain that's just not like his normal self. And so Greg goes back to the doctor and is tested for valley fever. He now has valley fever that had spread to his brain. Now, if Greg or his physician would have been educated on valley fever, his symptoms may not have progressed as rapidly, and he may have had a different outcome. So I'd like to introduce you to a topic that I don't think is highlighted enough, and that's self-advocacy. Self-advocacy can loosely be defined as an individual's ability to effectively communicate their desires, needs, and rights to someone else. Remember Greg I mentioned earlier? Well, his daughter started to develop similar symptoms. She started complaining to her mom, saying, "Mommy, I'm just so tired, I don't want to do anything." So her mom takes her to the doctor and prompts the doctor saying, "Please test my daughter for valley fever." Sure enough, a few days later, tests come back positive. She's able to take antifungals and clear the infection on her own and is now living a happy and healthy, normal life. It was because Mary was able to advocate for her daughter that she was able to recognize the signs and symptoms of valley fever. Now, if you zoned out these past 5 minutes, I want to leave you all with this. Speak up for yourself and your loved ones if you're concerned that you may have valley fever. Stay informed on valley fever cases happening in your community. And lastly, prompt your doctor and simply ask, could this be valley fever? Thank you all for listening to me today and joining me in this fight against this disease.